Hello everyone, my name is Faisal Nadeem and welcome to our another video on job interview training course. In this video, I will teach you how to prepare for a caregiver job interview. If you are applying for a caregiver role, make sure to stay tuned to this video because I promise to help you pass your interview at the first attempt. And to achieve this objective, I'm sharing with you the top most important caregiver job interview questions along with their sample answers. I will also let you know the purpose of asking each question from the hiring person so you can create your answer by including all those important things that I will teach you in this video. I have already uploaded a video on caregiver job description that can also help you a lot in your interview preparation. The link is in the description of this video. Very quickly before we get started, if you are watching my video for the first time, make sure to hit that subscribe button and also ring the notification bell so you won't miss any of our upcoming career focused content. Alright, let's jump in. So, the first important question that you should need to prepare for is, can you describe your experience in caregiving and the types of patients you have worked with? Basically, the purpose of asking this particular question from your interviewer is that your interviewer wants to assess your experience and the range of care you are capable of providing. Okay, so how you can answer to this particular question is that, well, I have over 3 years of experience as a caregiver, primarily working with elderly patients, including those with Alzheimer, dementia, and mobility issues. I have also cared for patients recovering from surgery and those with chronic illness. My responsibilities included assisting with daily activities, administering medication, providing companionship, and ensuring a safe environment. Question number 2. How do you handle stressful situations or emergencies when caring for a patient? Basically, the purpose of asking this particular question from your interviewer is that your interviewer wants to evaluate your ability to stay calm and effective in high pressure situations, which is very crucial in caregiving. Okay, so how you can answer to this particular question is that, well, in stressful situations I remain calm and focused on the immediate needs of the patient. For example, if a patient falls, I first ensure they are safe and assess for any injuries. I then follow the proper protocol, which includes calling for medical assistance if needed and informing the family or healthcare provider. I have been trained in first aid and CPR, which helps me respond effectively to emergencies. Question number 3. How do you ensure that the dignity and independence of your patients are maintained? Basically, the purpose of asking this particular question from your interviewer is that your interviewer wants to assess your understanding of patient centered care and, more importantly, your ability to respect and support the dignity and independence of those you care for. Okay, so how you can answer to this particular question is that, well, maintaining a patient's dignity and independence is very important to me. I always involve them in decisions about their care, encouraging them to do as much as they can for themselves while providing support where needed. I listen to their preferences and needs and ensure they feel valued and respected. For example, if a patient wants to dress themselves, I assist only as much as necessary, allowing them to maintain their independence. Question number 4. Can you give an example of how you handled a challenging situation with a patient or their family? Basically, the purpose of asking this particular question from your interviewer is that your interviewer wants to evaluate your problem solving skills, your empathy, and more importantly, your ability to manage challenging interactions effectively. Okay, so how you can answer to this particular question is that, well, I once cared for a patient with dementia who would become agitated during certain times of the day. To handle this, I developed a routine that included calming activities and ensured a peaceful environment. I also communicated regularly with the family to understand triggers and share strategies. By keeping them informed and involved, we were able to work together to manage the patient's agitation effectively. Question number 5. How do you stay organized and manage your time effectively when caring for multiple patients or handling multiple tasks? Basically, the purpose of asking this particular question from your interviewer is that your interviewer wants to assess your organizational and time management skills, which are essential in caregiving roles. Okay, so how you can answer to this particular question is that, well, I prioritize tasks based on the needs and schedules of my patients. I use a daily planner to keep track of appointments, medication schedules, and other important tasks. I also prepare as much as I can in advance, such as setting up medications for the day and organizing activities. By staying organized and proactive, I ensure that each patient receives the attention and care they need without feeling rushed. So there you have it, 5 most important caregiver job interview questions along with their sample answers. I have already uploaded a video on caregiver job description that can also help you a lot in your interview preparation. The link is in the description of this video.